Hello and welcome to yet another episode of Hair Talks by Terra Medical. My name is Dr. Joshua Chong, and this week we're going to be answering some questions that some of you guys have been putting on our YouTube comments. I'm so sorry for not answering it a little bit earlier, but we'll get to all these questions and answer them in this video, so stay tuned.
3, 2, 1.
First question. This is regarding the Norocrine Hair Growth Plus in Clinic supplement. Now, one of our friends here have asked, is there a difference between this product, Norocrine Hair Growth Plus in Clinic, versus Nutrafol versus Miraca? Now, Miraca, let me explain first, is a hair supplement that contains some collagen, some vitamins, biotin, and is something that's quite new on the market. I don't personally use Miraca because I prefer to use a more holistic option in the form of Nutrafol. And the main difference between Norocrine Hair Growth Plus in Clinic and Nutrafol would be that Norocrine is quite a targeted supplement. It is a proteoglycan replacement therapy. It contains 3 vital proteoglycans that help the hair follicle try to re-enter a normal growth phase, or a normal hair cycle, if you will. And Nutrafol does a completely different set of things with the same aim, to enter that normal growth rate of the hair. But it does so by optimizing the nutrition level within your body. It does so by providing you with herbal sources of antioxidants and anti-inflammatories, as well as a good sustainable source of collagen in the form of fish scale derived collagen that fuels the growth of your hair follicles and your hair. Second question, also pertaining to Norocrine Hair Growth Plus in Clinic. Our friend here has said, I've been using the old school regimen of finasteride and minoxidil for years. Is it possible to take this instead and achieve a better outcome? I would say that there are no head-to-head studies between Norocrine's product versus finasteride versus minoxidil. But what I would suggest is, if you have already achieved a plateau effect of finasteride and minoxidil, and because you've been using it for years, and you've seen actually a decrease in the amount of hairs over that time, I would add Norocrine on rather than use it in replacement of finasteride and minoxidil to try to elicit more hair growth. And the way I would do that is to take 3 tablets per day for about 6 months, see what we are able to achieve using serial photography in terms of monitoring that coverage, and then make a decision whether or not to decrease the supplementation dose to 1 a day. Third question, one of our friends here has asked, how do we differentiate between male pattern hair loss and telogen effluvium? Now, this is a very interesting question. So telogen effluvium is a condition where hairs are usually shedding a whole lot, and this follows an acute stressful event. Telogen effluvium is frequently self-limiting. That means even if you don't take any kind of intervention against it, it resolves on its own and the hairs start to grow back after about 6 to 8 months. Male pattern hair loss, on the other hand, is a progressive condition that lasts your entire life. It happens to a large amount of men, probably 75% of men in their lifetime, and typically follows a pattern, hence male pattern hair loss. And that pattern would involve hairline recession, crown thinning, and sometimes the joining of the two to form a completely bald upper scalp. It does not always have the feature of heavy shedding, but always will show on a trichoscopy the presence of miniaturized hair follicles. Question number 4 is quite an interesting question. One of our viewers has asked, can minoxidil keep its efficacy as long as it's used? Now, I guess what this viewer is referring to is, if you continue to use minoxidil long term, are you going to continue to see significant results? Or do the results actually start to wane over time? Now, if you use the same dose of minoxidil consistently over time, you can still expect the effects of male pattern hair loss to eventually catch up. The reason for that is because it is a process that is also driven by male hormones, and hence only using minoxidil without using finasteride will only solve part of the equation. Eventually, the male hormones will cause further miniaturization of the hair follicles and you will see some thinning of the hairs. Secondly, as we age, we know that hair follicles go through some senescence, which means that the hair follicles actually shrink because they've just gone through that many rounds of growth and shedding and growth and shedding, many cycles of hair growth. And as a result, minoxidil is not expected to last you your life long in terms of keeping your hair nice and strong. In some cases, we do have to up-titrate the dose of minoxidil to maintain the effects. However, minoxidil should only be titrated in its dose by an experienced medical professional because there are certain risks of side effects when you're taking minoxidil orally. Question number 5 actually is pertaining to the Regenera Activa procedure, and our viewer has asked, when the doctor extracts some tissue samples, does that mean that he extracts some hair follicles? So will I lose hairs in the donor area? If so, it would be a bad idea to do Regenera Activa many times. He's not wrong in saying that. So when we are extracting samples of skin to perform a Regenera Activa procedure, it is done in the donor area as well, or slightly outside the donor area, and there are hair follicles there. The whole idea behind Regenera Activa is to get some hair follicle stem cells. I would say on average, patients will lose maybe a few strands of hair in the process. It's not going to be resulting in big bald patches like how FUE scars may look in the old days where they were quite large and circular in nature, but rather what might be left behind is just slightly thinner hair when they've been extracted. And I usually perform my Regenera procedures on alternate sites if my patients were to have to repeat the procedure. So those are just some of the questions that were posed to us on our videos. Keep the questions coming, they're really very interesting. Thank you for other viewers who have helped to answer those questions. Very insightful to see all of your comments, and I look forward to hearing more from you guys. If you have any interesting questions, please leave them in the comment sections below. Please also remember to click like and subscribe for more hair and hair loss related content. I'll see you next time. Bye.